I'm Dr. Lorraine Dontigny, gynecologist obstetrician in the Montreal area for over 22 years. Today, I'm taking you on the rounds with the greats with menopause specialists. Through short video segments, the round act as a learning tool for women like you who are going through major hormonal disruptions. Each of the specialists we meet will share their knowledge on various menopause-related topics, your overall health, your sexual health, your quality of life, and available therapeutic options, both hormonal and non-hormonal. I'm positive that by better understanding what you're going through, you'll be better prepared to discuss it with your physician and make sound decisions on recommended care options. Are you ready? Let's do it!
Dr. Desindes, I'm pleased to be with you today. The pleasure is all mine, Dr. Dontigny.
I know this isn't the easiest topic to address, but I'd like to discuss one that you care about deeply: the menopausal transition. But before we jump right into it, could you tell us the difference between menopause and the menopausal transition?
I'm glad to address this first, because it's often neglected. We've heard a lot about postmenopause, hormone therapy. Many scientific studies exist on postmenopause, hormone therapy, non-hormonal treatments, but there are few studies on the menopausal transition. We rarely hear about it, and we often confuse premenopause, perimenopause, menopause. For many women, it's the hardest period to go through. Sadly, we're not sure of what's happening in our body, and it's worth demystifying it. The menopause is the last period. What happens to your body is that women are born with a limited amount of eggs, and around them are follicles, which secrete hormones. With time, there are fewer eggs and hormone-secreting follicles, and then whoops, little to no hormones are secreted, and periods stop. So, that's what happens. Each month, women experience hormonal variations, but these variations are even greater during the menopausal transition, and we'll see together what it can lead to.
Thanks for this great explanation. It's a bit clearer now. If we focus on the menopausal transition, we know that it's divided in 3 stages. Can you explain how these 3 stages differ and what women experience as they go through each?
There are indeed 3 stages in this transition. The first stage is the end of reproductive life. It's usually in the early to mid-40s, sometimes starting in the late 30s, when ovaries contain fewer eggs and follicles and some hormonal changes start to occur. What happens in our body is fascinating. Since ovaries have fewer eggs, signals change slightly. The menstrual cycle can really shorten. It's not rare that women who had a 28 or 30-day cycle see it go down to 23, 24, or 25 days, often with double ovulations. And thus, far higher hormone levels than during our 20s and early 30s. So our PMS can be worse in our 40s. So, increased breast pain, more bloating, greater psychological symptoms, mood swings. It's not uncommon for women to feel that it didn't used to be so bad, but it's getting worse. And sometimes, you'll get hot flashes, often following an extra glass of wine or a nice dinner. That's what emerges at this stage.
At this stage, are ovulation and pregnancy still possible?
Oh yes, there's ovulation at this stage and possible pregnancies.
Okay, let's move on to the second stage.
We often hear the term premenopause, and that's fine. But it's in fact called the early perimenopause. This means that, at this stage, our ovaries still contain eggs and follicles, but these are poorer ones, the good ones are already gone. So, ovulation won't happen every month, despite egg development and estrogen secretion that can be abundant. How long does it take to go from one stage to the next? It varies greatly with every woman. So, ovulation isn't monthly anymore, but hormonal secretion remains heavy. Periods become erratic, thus irregular cycles. You could have 2 periods in the same month. Other times, your cycle will last 35, 45, 60 days. The symptoms as well will vary greatly. Hormonal levels may be very high, causing symptoms akin to PMS symptoms. Or levels may be weaker, leading to hot flashes or sleep issues, and psychological symptoms that can fluctuate a lot too. I call this period the hormonal roller coaster.
As periods vary from very abundant to regular, is there a specific examination that women should know about if their periods are so unusual at that time?
You make a great point. It's a time where there's a stimulation that can be major due to estrogen. Since ovulation doesn't occur every month, there is less progesterone to stop the effect of estrogen on the uterine glands. So overstimulated cells can develop that can even become precancerous then. That's why it's critical to get an examination, to seek medical advice, to check for prolonged bleeding. Also, to make sure to prevent overstimulation, you need to discuss proper treatment in order to 1. Solve the menstrual issue, as periods can get quite uncomfortable, and 2. Prevent hyperstimulation in the uterus and precancerous cells.
It really is a continuum. We saw the late reproductive stage, early perimenopause, and what is the third stage?
The late perimenopause. At this time, eggs and follicles are extremely scarce, and hormone secretion, especially estrogen, is vastly reduced. This leads to missed periods. Intervals without periods get longer and more frequent, 2, 3, 4 months at a time. And when we do have our period, bleeding is lighter and often shorter. That's a sign that the endometrium, the inner lining of the uterus, is far less stimulated by hormones. Fluctuations are wildly reduced. Symptoms associated with low estrogen multiply, such as hot flashes, sleeping issues. Psychological symptoms are especially important during the early perimenopause. They can linger during later stages of perimenopause. They tend to be smoother by then, since major hormonal variations are gone. This leads slowly but surely to a year-long absence of periods. Thank you, Dr. Desindes, for being with us today and explaining this highly vulnerable time for our patients. Now that we better understand the menopausal transition, the next segment will address related medical care and treatment.